Good morning, everyone. Welcome to our Grand Rounds. My name is Suresh. I'm with the divisions of Health Informatics and Emergency Medicine. It's my pleasure to introduce today's Grand Round speaker, Dr. Sanghamitra Misra. Dr. Misra is an integrative pediatrician with a passion for serving vulnerable populations, such as immigrants and refugees. She obtained her medical degree from Texas A&M University and did her pediatric residency at Baylor College of Medicine. Additionally, she received a Master of Education degree in Curriculum and Instruction from the University of Houston. She's a graduate of the prestigious Robert Wood Johnson Foundation Clinical Scholars Fellowship Program, which is a 3-year equity-centered leadership training program. Currently, she's a professor of pediatrics and course director of the Pediatric Core Clerkship at Baylor College of Medicine, medical director of the Texas Children's Mobile Clinic Program, which brings comprehensive healthcare to under-resourced children in the Houston area. And she also directs the Integrative Medicine Program at Texas Children's Hospital. Dr. Misra has published on a variety of topics: immunizations in public schools, refugee health, mobile clinics, social identities of medical students, and various aspects of integrative medicine. Additionally, she serves as a section editor of Up to Date. A leading researcher in integrative medicine and medical education, she has received support from 11 different funding agencies, including the Maternal and Child Health Bureau. She is currently the chair of the board of the National Mobile Healthcare Association, chair of the American Academy of Pediatrics section on integrative medicine, and an appointed member of the AAP Committee on Pediatric Education. She is a doting mother of 3 and somehow found the time to serve as a board member for 4 nonprofits, including Undies for Everyone Incorporated. I've had the great opportunity to collaborate with Dr. Misra and publish papers on the value and impact of artificial intelligence in pediatric medical education. As you can see, she's a national expert in more than one area of healthcare. Today, she'll be talking to us on the evidence and ethics of integrative pediatrics. Dr. Misra.
Thank you so much for having me here today. I'm excited to talk to all of you about such an important topic. You counted how many places I've had grants from. That was very, very kind of you. So I really am appreciative of this opportunity because pediatric integrative medicine is not a very well-known topic, but there's a lot of us, and I'm here to tell you all about what I love about the field. So I did the full training of integrative medicine and am board certified, and so I have a different perspective, I think, than some other physicians. So I don't have any disclosures. Today, by the end of this presentation, you will all be able to describe the role of integrative medicine within the pediatric schema of healthcare, list some commonly used evidence-based modalities, and discuss some ethical considerations. So I'm going to start with some definitions. So you may have seen many of these terms. You may or may not know what they mean. They don't all mean the same thing. So I'll start by saying what conventional medicine is. That's what we do. That's what we're trained in, whether you're an osteopath or an allopath. Complementary medicine means someone is using something that is not what we learned about in medical school, not what we trained in pediatrics, but they're using that modality in conjunction with what we are doing. So for example, a mother has a new baby, the baby has colic, and they take the baby to the chiropractor, but then they still come and see us for the well-child visit. That's considered complementary. Alternative medicine means they never come and see us. 4% of Americans actually use alternative medicine exclusively. That means that they are not coming to us for well-child visits. They're using a different form of medicine for their care. And the studies have shown that even at end of life, they don't come and see us. They're very happy with their own traditional form of medicine. Integrative medicine is what physicians practice. If we're an MDDO and we're utilizing therapies that are complementary, those things we didn't learn about in medical school, in a very coordinated way, that's what we call integrative medicine. Traditional medicine, which you may have heard, it actually depends on who you ask. I ask my residents every month during their CAM day, what's traditional medicine? And they say, oh, that's what we do. That's traditional medicine. But if you ask a layperson what traditional medicine is, they'll say, oh, it's what my family does. It's our traditions. Folk medicine is the use of indigenous plants, usually, as therapies, and it's usually a tradition that's based on oral traditions. And then holistic medicine means care of the whole child. So all somewhat related, but somewhat different. So this is the definition of integrative medicine from the American Board of Integrative Medicine. So it is the practice of medicine that reaffirms the importance of the relationship between the practitioner and the patient, focuses on the whole person, is informed by evidence, and makes use of all therapeutic approaches that are appropriate, healthcare professionals, disciplines, to achieve optimal health and well-being. So let me talk a little bit about pediatric integrative medicine. Dr. Kathy Kemper is known as our founder. She's the one that really said, we need a specialty that focuses on the whole child. And she's one of my mentors. She's absolutely amazing. And she did found the AAP section of integrative medicine. So many years ago, this is her quote from actually, I think, 2004. She said, integrative and holistic pediatrics is really just good medicine. It means caring for the whole child in the context of that child's values, their family's beliefs, their family system, and their culture in the larger community, and considering a range of therapies based on the evidence of their benefits and their costs. Though several children's hospitals have robust pediatric integrative medicine programs, I really like these two because they have really nice pictogram of what pediatric integrative medicine means. And you may not be able to see the writing very clearly on the one on the left, but pediatric integrative medicine incorporates a lot of concepts. And so, for example, if you look around this wheel, there's everything from mind, body, to nutrition, to sleep, everything that really makes a child thrive. So in 2014, there was a Pediatric Integrative Medicine Leadership Summit, and 12 of the leading integrative pediatricians across the country were invited. And I was probably the most junior person at that meeting, and I was just thankful to be there and to be invited. And we spent 3 days together creating the concept of what is pediatric integrative medicine now? What is it going to look like in 10 years? Where do we want to be? What do you want people to think that integrative medicine is? And from that, we created a white paper. And I want to talk a little bit about this because I think it gives you a concept of what the field is. It's not just taking herbs and supplements. It's not just sending a kid to a chiropractor. So these are our guiding principles. So what is medicine should be? It should be preventive. It should be context-centered. It should be relationship-based. It should be personalized, meaning that not everything you do for each patient is going to work for the next patient. It should be participatory. So everyone that's involved in the care of this patient gets an equal voice in what happens. It should be ecologically sustainable, and it should be evidence-informed. So how common is CAM use? So the National Health Interview Study is conducted every 5 years or so. The first one was in 1991. And it is a survey that was created not for integrative medicine or complementary therapies, but for some reason they added a bunch of questions into it the first time they had it that had to do with how often are you seeing a practitioner that's not a physician? What types of herbs and supplements do you take? And luckily we have all of that data. And it's very interesting because every time they've had the study, about 33 to 35% of adults have said that, yes, I'm regularly using some sort of alternative therapy. And about 12% of children every time have said the same. And this is from a national sample of what you would assume mostly to be healthy families. But for chronic diseases, as you might imagine, the numbers are much higher, 3 times more likely to use CAM. And usually that's without our knowledge. We don't know that they're doing it. But specific studies have shown, for example, in epilepsy, about 30% of parents reported that they were using CAM. 60% of them had actually discussed their CAM decision with their child's doctor before using it. IBD, I think this one was at Denver Children's, up to 84% of children were using some other therapy. Muscular dystrophy, you can see, is also quite high, and sickle cell disease. And there's actually a lot of evidence in sickle cell disease for other therapies. But why do people use CAM? If you've read any of the studies, it's actually very interesting. Mostly it's because someone told me it works. My relative said that it works. My aunt told me it works. And now with social media, I saw online that it works. And so sometimes they're not actually dissatisfied with us. They're just, oh, well, I have this symptom. Why would I go to the doctor? Or some therapy or herb or supplement apparently just makes you feel better, right? So they're taking it not because they're trying to cure an illness. They're just trying to feel better. And actually, the studies do show that adolescents take herbs and supplements more than any other group. And people of high socioeconomic status, because they have access to it, are taking it. But even low socioeconomic status, because they don't have access to us so much, are also taking it. So what about our hospitals? So in 2012, I surveyed the freestanding children's hospitals. And at that time, almost all of them had some form of integrative therapy. So either they had a music therapist or they had someone that was doing hypnosis. And about 40% of them had a coordinated either consult service or a department. And I was really impressed by those numbers, right? This was more than 10 years ago. Integrative medicine was fairly new, but several hospitals had looked at this. And we're actually in the process of redoing this survey now to see what has changed in 10 or 12 years and also how COVID affected my program, the funding, everything changed. So in 2017, I did a study in our hospital. I randomized the children that got a pain consult. In our hospital, pain consults are done by the anesthesiology department. And I randomized them to either get an integrative medicine therapy or not. And I hired 2 medical students who were actually on leave from medical school so they could spend a lot of time with me, helping me with the study. And they came to me within the second week and said, "We're really sad with this study." And I said, "What's going on?" And she said, "Well, we tell the parents about all the opportunities they could have if they get chosen for the treatment side. You know, they could get me, they could get acupuncture, they can do hypnosis, they can have all these different things come, and then they get randomized to the control group and they don't get anything." And we were having trouble with recruitment. And then I realized that there was so many different types of pain within these patients that I wasn't probably going to be able to compare one child to another. So I said, okay, let's just change this. It'll be a feasibility study. And so we did it that way. And everybody that wanted a therapy basically could get it. And I was able to show with the data that our patients went home faster if we did the integrative therapy along with the pain consult. They were able to get off of their epidurals, get off of the opioids if we did this. It was just really incredible. And the best part was they all loved it. And the parents felt like the children were so much more calm after we left. And one kiddo I met during that time, at the time he was about 17, and I've seen him consistently in the hospital since then. You know, adolescents are very strange creatures, and sometimes you don't know how they're going to take the concept of, oh yeah, I'm going to do hypnosis with you. But this child, I did first guided imagery with, and then I started doing just mindfulness meditation with. And I would come into the room, his pain would be horrible, and his heart rate would be 130, 140. I would do simple mindfulness meditation, and his heart rate would come down 40 to 50 points. And he loved it. And so every time he wanted me to come, he would just tell the nurse, and I would come and I would literally sit with him for 5 or 10 minutes, right? And it's so impactful. It's so amazing to watch these children ask for something like this, right? He wasn't asking for more opioids. He actually wanted me to just come and sit with him and relax. And one time I told him, "You don't have to call me. You know how to do this. You can do this on your own." He said, "It's just more effective when you're here with me." And so I've experienced so much within our hospital of we can cure itching and nausea with things like acupuncture, which other medicines really, they have a lot of side effects, and sometimes they're not even that effective. And so we're not saying that, oh, we're going to replace pain, you know, the pain consult service with our service. That's not what we're asking for at all. We just want to work together to show that there are other therapies that you can use. So how about you? How does this affect your practice? So your patients are probably using therapies. So ask about it. Give examples, because if you just ask a little bit broadly, most people don't divulge this kind of information. But do not judge your patients and their families, even if in the back of your head thinking, "That's crazy, why are you doing that?" You don't have to be an expert in any of this, but if you are interested, we have fellowships, we have board certification, and we actually have a brand new Academy of Pediatric Integrative Medicine, which does focus training on pediatrics, because currently the board is for medicine, for adult medicine and pediatrics. But if you show some interest with your patients in research, they actually really appreciate it. And then you're actually making sure that they're not doing anything that's dangerous. So I surveyed, so I think Dr. Suresh made a comment that I run the mobile clinic program at our hospital. So we have trucks, we have 5 of them. We go out into the community. We see kids, it's a free service. It's not an integrative medicine program. It's a true like vaccine, well child, sick visit type of clinic. So on my clinic, and we only see uninsured children. So a few years ago, I surveyed 250 of our families to find out what they were doing. And almost half of the children were taking herbs and supplements regularly. And it gave me an opportunity to learn what they were doing. For example, one teenager was taking bird seeds and crushing them and making a tea out of them. And I'm sure in my face, I looked like, what on earth are you doing? And she said, oh, it's for weight loss. And I said, oh, wow, I've never heard that. And I'm pretty sure bird seeds are not consumable by humans, that they're not meant for us. And she said, well, all of my aunts take it and they're all super skinny and I want to be like them. And I said, great, well, let's stop the bird seeds. And we came up with other strategies for her because it was dangerous. We've had 2 children come to our hospital in the last 10 years in liver failure from green tea extract. How many of you know green tea extract? You know what it is. It's in a lot of supplements. So what happens is adolescents are kind of goofy and they'll take multiple supplements at the same time without realizing what's in any of them. And green tea extract is in some that are used for weight loss and some that are used for bulking. Both of these children, adolescents, were taking multiple supplements. And when the first one came to our ER, ended up in the ICU, no one understood what had happened. They thought it was some sort of idiopathic liver failure. And then someone took a really good history and realized what it was. And actually that someone published that case report from GI from us. And then the second kiddo showed up about 3 or 4 years later and everyone was like, have you been taking green tea extract? And so these are things, if you don't ask, you don't know your patients are taking them. So you don't even know that you need to counsel them not to do so. The other thing is you have the opportunity to stop, to learn more about your patients and stop them from doing things like taking green tea extract. When I did that study on my mobile clinic, I actually asked one of my residency batchmates from 15 or 10 years previously to do this study in her clinic too. And she's actually Venezuelan, so she had a very Spanish speaking population. And my patient population is almost 99% Spanish speaking, but she had a high socioeconomic status in her clinic. They don't even take CHIP. They only take private insurance. So I wanted to compare largely Hispanic, low and high socioeconomic status. And she said, sure, I'll do this, but I've been in my practice for 10 years and none of my patients use any of this stuff. And she said, okay, and she interviewed 100 of her families. And 85 of them were actually using something, either an herb or a supplement or visiting someone else. And she was in shock. She diagnosed 3 kids with asthma that she didn't know they had asthma because they were taking herbs. One of them was taking homeopathy for ADHD, all kinds of things. And she said, Mitra, I thought I knew these patients. I really thought I knew these families. And they were so thankful that she asked. So the NIH has a division called the National Center for Complementary and Integrative Health. And just like any of the other divisions, they provide grants, they provide support. And they divide the different forms of CAM like this, and that's how I'm going to talk about them just a little bit. I'll focus on each one. Obviously, none of these have anything to do with each other. They're just lumped together because it's not what we practice. That's not what we practice, not what we learned about. So the first group is biologically based systems. So these are herbal products. And herbal products just means it came from a plant, either the root, the leaf, the stem, and somehow you're ingesting it or putting it on your body. So in the past, they would make tinctures, hundreds of years ago. And now everything is at Whole Foods in a pill. Dietary supplements, though, are a little bit different. It's something that you're already taking in your diet, but because of some studies or beliefs, we think that if you take it in mega doses, that it's going to make a difference. So for example, turmeric is a common one. At least Indians, we eat turmeric pretty much with every meal, but it's in a lot of foods. But we know that mega doses of turmeric are anti-inflammatory, and that's why we're using it. The second group are called mind-body practices. So this includes a wider range of therapies that are extremely impactful in children. So the first one is art, music, dance, pet, and aromatherapy. And we have all of these in our children's hospital. And we use them strategically to make sure that we are able to calm our patients at the times that they need it. But it's also really strategic. And for example, we have a neuro ICU that's meant for children that have had either severe brain trauma, strokes, things like that. It's a small bed ICU. And in that ICU, we have a neuro-trained music therapist. And when OT comes, she comes. And it is apparently standard of care across the country for OT to only come with music therapy for this type of a patient. There's no data. There's no good studies that show that it's effective. However, it's standard of care apparently across the country. So many years ago, we went to the division, the music therapist and I went to the division chief and said, can we randomize your kids just for a short amount of time so we can collect some data to show how effective this is? They wouldn't let us. She said, we know it's effective. We don't need to prove it. And I don't want to deprive any child of what they can get. And so we actually never did the study. So it is really important to me to think about why we're doing these. And the concept of evidence is very different in integrative medicine because we have such a personalized approach that sometimes you can't use the same therapy for the same child and expect the same result that you do for the next child. It's just not, unfortunately, it's not just the way it works. So other mind-body practices include biofeedback, clinical hypnosis, cognitive behavioral therapy, and diaphragmatic breathing. Have any of you ever seen biofeedback used? It's actually one of the more common forms. A lot of general pediatricians who are not integrative actually use it. We use it fairly regularly in our general pediatrics clinic. But I'll tell you a really interesting story. A long time ago, I was a resident and I was with an attending who had a patient with trichotillomania. And at that time, biofeedback was not as robust as it is now. So with biofeedback, you're measuring either heart rate, respiratory rate, blood pressure, something that's dynamic. And usually in children that have anxiety-related disorders, and trichotillomania does have a component of that, the heart rate starts to go up several minutes before the outcome. So before they start pulling their hair, there's actually physiological changes. So the point of biofeedback is to understand and help a child understand what their body feels like when those changes happen, and then use techniques like guided imagery or meditation or deep breathing to stop it. And you can actually prevent the trichotillomania, the pulling of the hair. And I saw that and I thought it was like a miracle. I was like, how did you get this kid to stop something that they had not been able to stop for a really long time? And it's not, there's no adverse events that come with biofeedback. But now, because of technology, biofeedback is amazing. They use a lot of video games. For example, in one of them that I've seen, there's like a hot air balloon going up, and as the child takes deep breaths, the hot air balloon starts to come down. So they feel it, they sense it, and they can see that their heart rate is coming down. So it's really fascinating. Other mind-body practices include guided imagery. If anybody used it, heard of it? Okay, so there's an Academy of Guided Imagery. It's meant for psychologists and physicians. It's a 2-year training program. I did it simply out of curiosity. You don't have to do the full program to do a little bit of guided imagery. You can just Google guided imagery script, see what they say, and then kind of mimic it. But I'll tell you a really interesting story. So about 15 years ago, 12 years ago, I wanted to learn about guided imagery. I read a couple of books and then I went to a weekend guided imagery training in Houston, and it wasn't meant for physicians. There was like Reiki healers there and yoga therapists there, all kinds of really interesting people. And I got to learn with them about guided imagery. And then that Monday, I was on the mobile clinics, and we are a very pro-vaccine mobile clinic. And I had a mom with 4 kids, and all of them were getting vaccines except for one. And I said, what? It's flu season. Doesn't your child even need the flu shot? And she said, oh, well, she has leukemia and she's seen at Texas Children's Hospital. We're not supposed to give her vaccines right now. I was like, oh, okay, tell me a little bit more about that. And I vaccinated the other 3 kids, pushed them out of the room, and sat down with this mom. She looked a little bit depressed. And so I thought maybe I could just talk to her a little bit. And the mom said, well, the week before chemo is just so hard. And I was like, do you mean before or after? And she said, no, before. And I said, well, how does she do after? She says, well, they give her this medicine for pain. They give her this medicine for nausea, and it usually helps, and she does okay. I said, well, tell me about what happens before. And she says, well, she has so much anxiety about having to go. She knows they're going to have to access the port. They know she really stresses about it. She doesn't sleep. She doesn't eat. She doesn't want to go to school, and it's miserable for the whole family. And I was newly trained in guided imagery, right? So I told this mom, well, I'm trained in something called guided imagery. I'd love to talk to your daughter about it a little bit. She said, of course. So she was 8. And I asked her, why she needed to go to the hospital for this treatment. And she said, well, I have cancer. And I said, what does that mean? And I have no doubt that our hem-onc department had spent endless hours explaining this to the family. But people hear what they want to hear. They're only able to intake so much. And I said, well, I think there's something in your blood. And she said, yeah, I think they said something like that. And so I said, why do you get scared? And she's like, well, I don't like the dripping in that thing. It hurts when they access the port. And what I learned from the mother is every time she went for chemo, they gave her a benzo to calm her down so that they could do the therapy. And so I said, well, you know what? You actually need that medicine. And so with guided imagery, we talked about what her cancer was, and she decided it was little red, little demons, basically, that were going through her blood and making her really, really sick. And I said, well, we can't have that anymore, right? And I said, we have to get rid of it. And so those little drips in the IV and the casing make a lot of people nervous because you see this big bag, it's like tiny little drops. It's like, oh my God, every single one of those has to go in. It's almost like torture. And she decided with me that each one was a whale. And when that whale came in, it was come in and it was going to gobble up all of those cancer cells. And she's like, that's what I need. And I said, yes. There's only one way to get that though, and that's with the chemo, and they have to access your port. And there's actually really good data in the adult oncology literature that if you believe your chemo is going to work, it actually works better. So that little girl, after talking to me, drew a picture. She stayed, they didn't have a ride to get home. She drew a picture with me, and it was of her, and it was of these red monsters. It had the whales in it and everything. And that little girl never got a benzo again. She went in for her chemo, happy as a clam, got what she needed, and went home. I am not an oncologist. I did not cure her cancer. But did I change that family? Yes. And that mom brought us donuts. So we were parked at an elementary school. Every week when we went to that elementary school, that mom brought us donuts for a year. And I actually got invited to her high school graduation. So I think the reason I tell this story is you don't have to cure cancer to be impactful in a child's life. And I can tell you at the bedside in the hospital, my residents do a lot. If a kiddo needs an IV, they will sit and do guided imagery with them. They'll do hypnosis with them. They'll take them on distraction, concepts, because it just makes them feel better. We traumatize our kids every day, right? We might not think it because they need it, but children are traumatized by everything we do. They remember. Why else would they scream when they see me and they know I'm going to give them more shots, right? We know it's for the better good, but we do traumatize them. So other mind-body practices include meditation, prayer, progressive muscle relaxation, and yoga. And I'll mention progressive muscle relaxation because it's one of the easiest things to teach kids. Which one of our kids sleeps well? Which one of our adolescents sleeps well? Probably none of them, right? They're on their phone until they go to sleep and then they can't sleep. So progressive muscle relaxation is something that actually my kids do fairly well. So the point is it's progressive, meaning you start from your feet and you work your way up. And you contract for 3 seconds and release your muscle group. So you start with your dominant side. So I'm right-handed, so I start with my right foot, contract for 3 seconds, release. Do the left foot, do the calf, come all the way up through the back to the body to the face. And the goal is that the child falls asleep before they get to the face. Very easy to teach. Explain it to your patient. Takes what took me 5 seconds to explain it to you. And it's one more tool that they can help when they're having trouble falling asleep. So manipulative and body-based systems, things like chiropractic, massage therapy, osteopathy. So chiropractors are ubiquitous. There's one on every corner. They see a ton of kids. There's hardly any evidence for anything that they do, but families love them. People go, they don't care that there's no evidence. I just did a review of the literature for chiropractic. So side effects are actually pretty rare and deaths are almost unheard of. So we don't have a lot of data to say don't go, but we don't have any data to say, oh, there's evidence for this, you should go. So the AAP's stance is if they're over the age of 1 and they're doing musculoskeletal manipulation, we're okay with it. Below the neck. Anything above the neck is hands off. So other therapies include massage therapy. And then I'm going to switch to alternative whole medical system. So this is where, if someone says they go to an alternative practitioner, it's only can be one of these because they are full forms of medicine. So Ayurveda is the one from India. It's 5,000 years old. That's when the original texts were written. Very little has changed. I actually love the focus of Ayurveda because it envelops everything that you would think that we should do during a wild child. Because they talk about nutrition, they talk about diet, they talk about rest, but they give you a prescription for it. So for example, I see an Ayurvedic practitioner. He's actually an MD like us, but he's also an MD PhD in Ayurveda. Actually, this Jewish guy from New York City who became a physician, then went to India and did all this training and came back, and he had a hybrid practice for many years in New York. So when they look at you as an Ayurvedic practitioner, they don't just see you as one person, they see you as a whole person. And they know all of us are different, right? Some of us talk fast, some of us talk slow, some of us wake up early, some of us wake up late. It's all your constitution, and it's very hard to change any of that. So we all have that in us. And so my prescription is, okay, wake up at between 5 and 5:30 a.m., which is what I automatically do anyways. Drink a glass of warm water, and we incorporate a lot of yoga and breathing exercises in Ayurveda. So I'm supposed to do certain breathing exercises. I eat a meal, my first meal at 7 to 7:30. They tell you like how much carb, how much protein, when you do incorporate fruits and vegetables, when you don't. And it's a full day's plan. They don't expect you to follow it 100%. But the days that I follow it, I'm like, wow, I feel really good today. Like my bowels are better, I have more energy, all those things that really matter. And so I feel like that's what I would love for our well childs to be. Unfortunately, in the system that we're in, how much time do we have? They're like shuttling our patients through in 10, 15-minute blocks. It's really hard to make a real impact. Homeopathy. How many of we've all heard of homeopathy? Okay. I'll tell you, this is why I started this integrated medicine journey. When I was a resident, my husband, who's very atopic since birth, asthma, allergies, developed eczema. And he's like 33 years old. And within 3 months, he was covered from his neck down to his ankles. Very bizarre. I mean, no area spared. And we saw dermatology. Everyone kept biopsying him. They're like, there's no way this is just eczema. But it really was. It always came back, just atopic dermatitis. And ended up on PO prednisone. So bad, couldn't sleep, Atarax at night. And then the doctor said, well, there's this new thing called Remicade. And this is really early on. When I went to med school, we didn't have biologics yet. So we were really scared when Remicade came out. And I was like, this is crazy. It's just eczema. And I was a resident. I was like, eczema is that thing that babies get in their antecubital fossa and you just put some Vaseline on it and it goes away, right? It's not this. So I was like, I'm really scared to start this Remicade. And so I have a lot of physician relatives in India. And they used to always tell me, and they're MDs, they used to always say, you know, homeopathy actually works for dermatological diseases, especially in something in allopathy where we're like, oh, you put steroids, you put antifungal. If it's really bad, you put both. They actually have a lot more opportunity for therapy. And so in Houston, there's actually a physician, MD, who does homeopathy. And so my husband went and saw him. At this point, he had been on prednisone for 18 months, on and off, couldn't get off. And even when he was on it, he didn't clear up. He was literally the same. And so my husband went, I didn't go with him. He said he talked to him for an hour and a half, and then he went into his lab and made the medicine. That's how homeopathy is. So there are homeopathic remedies in the grocery store, but those are not actually truly homeopathy. He made my husband his medicines. He took something in the office. He came home. I kid you not, by day 3, he was clearing up. And at a month, when he was supposed to go back for the follow-up, he was clear. He had a lot of scarring, but he had no new lesions. He'd been sleeping well. We're like, this is crazy. And if it was just placebo effect, I'm totally okay with that. So we called the dermatologist, and we didn't even go see her. We called her and said, you know, he's clearing up. Can we try weaning off the prednisone? And she was like, I've never seen a square inch of his body that was clear. How is this going to work? And I said, no, he's really clear. And then she said, did you see somebody else? And we're like, I don't want to say anything. And then I said, well, yeah, we actually saw a homeopath. And she's like, oh yeah, he'll be fine. You can wean him off. And I was like, what do you mean he'll be fine? She's like, oh yeah, there's some good evidence to show that it helps. And we were like, why didn't you tell us? And she's like, because the evidence is kind of case studies and just word of mouth, but you'll be fine. And he was. And that was 2005. And we weaned him off the prednisone, clear for years. And then in 2009, my father-in-law had always lived with us. He became very ill. It was really stressful. My husband started itching his antecubital fossa. He saw Dr. Robinson that one more time, and he's been fine ever since. So you can tell me that it was placebo effect. You can tell me things wax and wane, but I'm convinced it's whatever he did. And that gave me the spark to find out, why do people even use these therapies? Why is this so important? All right, I'm going to skip some of these. Talk about traditional Chinese medicine. Also a very 5,000-year-old practice. And the best part of traditional Chinese medicine is that acupuncture came from it. So they believe that qi is the life force energy. It flows through meridians through the body. And by manipulating those meridians, you can restore the flow of qi and restore health. So acupuncture, although it comes from traditional Chinese medicine, is considered an energy or biofield therapy. And so we don't know how it works. But there are several training programs for physicians that want to do acupuncture, and you can get board certified in acupuncture. And we used to have 3 physicians, 2 were rheumatologists, one's an anesthesiologist, that all do acupuncture. And we have a pretty robust acupuncture program. I know a lot of children's hospitals actually do. Although we don't understand the mechanism, but it's very helpful for pain. It's helpful for nausea, symptoms that are really hard to treat for us. So the US government has the NIH division that I told you about. But in 2002, they had a White House commission on complementary and alternative medicine. And this policy said, we need better education for everybody. Physicians should know more about these therapies. Those other therapists, practitioners should know more about what we do. And there just needs to be better regulation. And that's partly why we do have a little bit more regulation for different, like for example, for chiropractors and things like that. So let's talk about the ethics really quickly. So the ethics of CAM is really the ethics of any medication that we're using. So if we feel that it is safe and effective, and there's at least 2 randomized controlled trials to say so, then we use it. We're obviously going to still monitor, but we will go ahead and use it. If we think it's safe, but there's not really a ton of evidence that it's effective, most of us will tolerate it. It's going to be safe. Our patients do worse things. They drink like 12 sodas a day, and we're hardly able to stop that. So if they want to take a little bit of echinacea, I'm going to let it go. If something is efficacious, but maybe not safe, like liver toxic. So we at Texas Children's, we're next door to MD Anderson, and they have a very robust integrative medicine program. They actually use certain herbs. There's one for liver cancer that it's an herb, and it's actually pretty toxic to the kidneys, but they use it fairly regularly. So that's an example of very special use because the benefits outweigh the risks. But if it's not safe and not effective, please make your patients stop. We're not going to use those. And safety is most important. Herbs and supplements are not regulated, right? They're regulated like foods. And technically, anybody that sells an herb is supposed to have at least 1 randomized controlled trial that shows that it's effective, but nobody looks at it, so most companies don't even have it. So if we don't report adverse events, nobody will. So that's our duty. But you can have allergic reactions to herbs and supplements. There's natural variability of plants. And sometimes there's intentional spiking, like some of the weight loss supplements have like stimulants in them. And so, there's nothing that we can do. So there are third-party labs though. So these are the 3 biggest ones. The only way to think that what you're getting is actually what the bottle says that it has is if it has one of these seals on it. So that means that before it went to production, the company looked at it and tested it, and then they do random samplings from the stores, and they have to resubmit every time there's any change to the formulation. So this is fairly accurate in that way. But in 2015, I think Consumer Lab came out with a statement that only 10% of what they'd looked at that year actually passed. And the most common reason things didn't pass is because it didn't have enough of the active ingredient. But guess what? That other 90% probably still made it to the shelf. It just doesn't have any kind of a label on it. So it makes us a little bit nervous. All right, I'm going to go through a few cases really quickly. A 16-year-old male complains of red, not blistered skin after spending a little too much time in the sun. He was getting his vitamin D and enjoying the beach. Which herbal product can help him relieve some pain and promote healing? Yay, it's aloe vera, used for centuries, very safe for topical use. But I think one of the most interesting things that it's changed is radiation therapy. All radiation therapy now, they use aloe vera gel afterwards. There used to be a lot of breakdown of the skin after the therapy, and this is actually almost completely gone with the use of aloe vera. But for our patients, minor thermal burns, sunburns, it's perfect. And I have a little bit of information. We know it does have some antibacterial effects, and some in vitro studies have shown that it's anti-HSV. You come home after a long day at the office and want to use an herbal product to help you relax. Assuming you aren't allergic, which of the following herbal remedies is best options? Safe and won't make you totally fall asleep. Any ideas? Chamomile, very good. So chamomile, mildly anti-inflammatory, mildly sedative. The best part about chamomile is it actually relaxes intestinal spasm. So we don't have very much for that in allopathy, right? A kid comes in and they just really probably ate something bad, or they have a little bit of a GI bug. perfectly reasonable to try chamomile. It is related to ragweed, which is related to chrysanthemum. If somebody is allergic like I am, I can't drink chamomile. I get super itchy. So that's the only real consequence. It does have coumarin in it, which is like 1 oxygen from here to here. So it does thin the blood a little bit. So you have to stop it before surgery. And chamomile actually can have botulinum toxin. So there are studies that show that it's effective in colic. Actually, there's one really well done randomized controlled trial showing that it's effective in colic. What we say is if the chamomile preparation was made in the US, then it's safe. If it wasn't made in the US, we don't recommend it. So it's interesting, about 15 years ago, I put chamomile into PubMed and there was like, I don't know, 40 studies or something. I was like, wow, that's a lot of studies. It's like over 1,000 now, I think. People have studied it in a lot of different things. But it is beneficial in hospitalized patients. It's beneficial for colic and definitely helps with diarrhea. A 16-year-old female patient complains to you that she's having trouble sleeping at night. She thinks it's because she's stressed at school with homework and all of her extracurricular activities. What is a good option for her to sleep? Okay, I think you all want to say melatonin. That's not the answer. The answer is actually valerian. So valerian actually binds GABA receptors, can be very helpful for sleep, anxiety. It has been used by the US government and our armed forces for a really, really long time. It's about 5% of people get a little bit of headache with it, but it's very safe. And if you had an adolescent who intentionally overdosed in the past, it doesn't interact with alcohol. It doesn't interact with anything. We recommend this first line for sleep in our clinic. It's also helpful for ADHD patients who we've given stimulants to and they can't fall asleep at night. Great way to help them calm themselves. And then very specifically for certain types of depression, it's very helpful. And then for some of our children that are in the complex care clinic that aren't very active during the day and they don't sleep well, they move all night, the parents get very upset. Valerian is a great option for that. So why is it not melatonin? So melatonin is completely used inappropriately currently in the country. There are various sleep specialists that are just aghast at what's happening. Melatonin is not a sleep aid, right? It's a hormone that we normally produce to help us go to sleep. And replacing it exogenously is not the smartest thing to do because we do think there is some suppression. There might be some endocrine abnormalities that happen with these supplements. And the thing is, on these supplements, you have no idea, honestly, what you're getting. So where is the evidence for melatonin? It's really only shift work disorder and jet lag. Anything other than that, you shouldn't be used. The exception is hospitalized kids. So they don't have the normal circadian rhythm because they're in a room, usually doesn't have lights coming on all night. That's an appropriate use for melatonin. But for a child that just has poor sleeping hygiene, stays up too late, not appropriate. I will use it, however, if my teenagers, over Christmas holidays, they start staying up late and late and late and late. And then when school's starting, they're like, I can't fall asleep to go back to school. That's kind of like shift work disorder. It's kind of like jet lag. So it's fine. You can reset a kiddo with it, but we recommend 3 weeks on and then stop. A 9-year-old presents with cold symptoms. Mom has already given him vitamin C, zinc lozenges, and chicken soup. Anybody heard of some immune modulators? So these are the 4 big ones: echinacea, elderberry, ginseng, and astragalus. All of them actually have a fair amount of evidence, and I don't mind if my patients take any of them. This is a really interesting study that's very new. They looked at echinacea, zinc, and vitamin C in adults, and the data was actually better than we could have imagined. So for yourself, when the next time you get a cold, try these 3 together. Elderberry is the most commonly used right now in kids. The sad thing is we have the least amount of evidence for it and the least amount of evidence for kids in it, but it seems to be fairly safe. You could buy elderberries themselves and just take the doses a palm size of the child's palm once a day, and it does help prevent and help with symptoms of flu. In ginseng, we have actually the most amount of kid data, so children can take it. And these are immune modulators, meaning they help prevent infections during cold season. They can reduce the duration of days. A 17-year-old presents with recurrent migraines. She keeps a headache diary, avoids triggers. She started B2, 5-hydroxytryptophan, and fish oil. What could help her? So the answer is all of the above. Ginger is an effective medication for nausea. We know it's been used for post-op nausea, vomiting. It's been used for pregnancy. Anybody can take it. Hardly anybody's allergic to it. This is probably very small for you to read, but this is the American Academy of Neurology and American Headache Society's migraine prevention guidelines. And the way they have it categorized is how effective it is for migraine prevention. So level A, B, and C. And level A includes propranolol, metoprolol, and it includes butterbur, which is one of my choices. Level B is probably effective, meaning it actually means there's one well-done randomized control trial and one less well-done randomized control trial. And that includes MAG, naproxen, and it includes feverfew, which was one of my other options. So butterbur is used widely across the country for migraine prevention. And the reason is the other option is a beta blocker, which a lot of people don't tolerate. So a lot in our Baylor Neurology adult clinic, they start with butterbur and they only change if it's not working. There are some concerns about these PAs within butterbur. So as long as it's PA free, you can use it for your patient. And the last option was clinical hypnosis. And clinical hypnosis is like magic in my mind. You can get children to abort headaches that have already started. They can, when they have an aura, they can do hypnosis and get themselves out of the spiral to prevent the headache. A 6-year-old brought to your clinic and mom's concerned that she's giving her nasal steroids and oral antihistamines for her allergies. She wants to know some natural therapies. So there are a host of herbs that are used for allergies, but I say the most important thing is that they're cleaning their nose. Because even if you're doing just Flonase for them, it's going to be more effective because there's not gunk in there that's absorbing the steroid that you're doing. A 7-year-old presents to the clinic with recurrent abdominal pain and no identifiable organic cause. He's very scared of needles. His parents are interested in non-pharmacological therapies. So what could you try? So the answer is the first 3, and we're only not doing acupuncture because he's scared of needles. But there's good evidence for all of these. A 5-year-old comes for a well child visit. The parents are concerned about the diet, and they ask about organic foods. And just in the interest of time, there's not a lot of data on what organic foods do for us. The true reality is that if you look at urine from a child that eats organic food and urine from a child that does not, the one that eats regular foods, they have pesticides in their urine. Very, very large amounts. So we've never really been able to correlate, though, does that matter? What does that mean for the child's health? But most people feel like probably don't want the pesticide going through the body. And so that's why most people do try the organic foods. Also, there's just good data to show that it's beneficial to our environment. Okay, a 45-year-old pediatric faculty member wants to make some changes in their life to feel more focused during the patient care and have more energy. What interventions could help? Mindfulness and stress management, time management, overall health and wellness, cognitive training with focus-enhancing apps. It's all of the above. And so all of us, although we're thinking about our patients, it's important to think about ourselves too. And we're not trying to battle burnout. I'm not even going to go there. But there are things that we can do for ourselves because people are going to make us upset. Epic is going to make us upset. And all you can do is reduce your own heart rate with your own techniques. And I think there's one of the integrative medicine folks at MD Anderson one time gave a talk for us. And he said, oh, but you have that mindfulness gadget in your offices. And I was like, what do you mean? He's like, the hand sanitizer. And I was like, what do you mean? He said, when you go into the room, the first thing you do is take hand sanitizer. And as you're letting it dry, you're purging your mind of everything that happened with the last patient, purging your mind of the fight you had with your spouse, and you're going to focus all of your attention on this one child. And I thought that was actually really sweet because we don't do that. We're running from room to room. We don't take a minute because we don't have that minute. You're going to use the hand sanitizer though. And it is smart to just take a second and refocus yourself. Several integrative medicine fellowships are available. There are free resources online, some you can pay for. And there are a host of books if you're interested in learning more about this field of medicine. If you're just interested in learning a little bit more and not training, the AAP has our section of integrative medicine. The listserv is amazing, and you can see a list of other organizations. So lifestyle medicine, obesity medicine, a lot of these are very helpful training programs. So we do include obviously a vast array of therapies. Evidence is building for a lot of them. And just really, I encourage you to ask your patients and just learn from them. You'll be happier, you'll learn more, you'll do some Googling. It's fun. It really is just fun. And our mantra is universal love is the greatest healer, and I genuinely believe that. So thank you for your time.